Hello and welcome back to ER Mentorship Hub, the place where we delve into the intricacies of emergency medicine and the principles that guide our practice. Today, we're focusing on a fundamental aspect of medical ethics: autonomy. Let's explore this through a case study. Our patient, Melissa, a 35-year-old woman who arrives at the emergency room with a severe allergic reaction. Sarah is conscious and clearly expresses her refusal to receive a certain medication due to her personal beliefs. This puts us, as healthcare professionals, in a challenging position. But first, let's break down what we mean by autonomy. In the realm of medical ethics, autonomy goes beyond simply allowing patients to make decisions. It's about actively respecting and supporting their right to self-determination. This concept is rooted in the belief that every patient is an individual with unique values, beliefs, and preferences that play a crucial role in their healthcare decisions. Autonomy is based on the principle that competent adults have the moral right and capacity to decide what can be done to their bodies. This means that as healthcare providers, we have a duty to provide patients with all relevant information regarding their condition and the potential benefits and risks of different treatments. It's not just about giving them choices, it's about ensuring they have the understanding and freedom to make informed decisions that align with their personal values and life goals. This principle also involves recognizing that patients may have different views about what constitutes a good or desirable outcome. For some, prolonging life at all costs might be paramount, while others might prioritize quality of life or pain relief, even if it means a shorter lifespan. Respecting autonomy means understanding and honoring these preferences, even when they differ from our own professional opinions or recommendations. In practice, respecting autonomy involves clear communication, empathy, and a commitment to patient-centered care. It's about building a partnership with patients where their voices are heard and respected. This is especially important in emergency medicine, where decisions often need to be made quickly and the stakes are high. By upholding the principle of autonomy, we not only respect our patients' rights but also foster trust, which is crucial in the therapeutic relationship. To sum it up, autonomy in medical ethics is not just a principle. It's a commitment to recognize and respect the individuality of each patient, ensuring their right to make informed decisions about their healthcare. As emergency medicine professionals, it's our duty to support this autonomy, providing the necessary information and support for our patients to make choices that truly reflect their personal values and desires. However, there are exceptions. Autonomy can be overridden in cases where a patient's decision could lead to significant harm to themselves or others, or if the patient lacks the capacity to make an informed decision. For example, in the case of severe mental illness, or when a patient is unconscious. Let's also address a crucial aspect of autonomy in special populations, particularly children and mentally incapacitated individuals. What happens when their caregivers refuse further treatment? In pediatrics, the autonomy of a child is often limited by their age and development. Here, parents or legal guardians usually make healthcare decisions. However, if a caregiver's decision is deemed to be against the best interests of the child, such as refusing life-saving treatment, medical professionals are ethically and legally obligated to intervene. This might include seeking legal authority to proceed with the necessary treatment. Similarly, for mentally incapacitated adults who cannot make informed decisions, caregivers often step in. Yet, if a caregiver's decision is believed to significantly harm the patient or contradicts previously expressed wishes of the patient when they were capable, healthcare professionals may need to challenge this decision. This could involve ethical committees or legal intervention to ensure the patient's best interests are served. In both scenarios, the challenge lies in balancing respect for autonomy with the duty to protect those who cannot make decisions for themselves. It's a delicate balance, requiring careful consideration, often legal counsel, and always with the patient's best interest at heart. Let's consider another scenario to further understand the importance of autonomy in clinical practice. Imagine John, a 60-year-old man with a history of chronic kidney disease. He's been advised to undergo dialysis, a life-saving treatment. However, John is deeply concerned about the impact this will have on his quality of life, fearing it might restrict his independence and the ability to travel, activities he deeply values. In this case, John's medical team must respect his autonomy by thoroughly discussing the implications of undergoing or refusing dialysis. This involves not only explaining the medical aspects but also understanding John's personal values and concerns. It's crucial to present him with all possible alternatives and outcomes, including conservative management without dialysis, and the potential impact on his health and lifestyle. If John, after understanding all the information and consequences, decides against dialysis, his decision must be respected, even if it goes against medical recommendations. This situation underscores the importance of autonomy. It's about respecting John's right to make a decision that aligns with his values and beliefs about what makes life worth living. In supporting John's autonomy, the healthcare team should also provide comprehensive support for his choice, including palliative care options and strategies to manage his condition without dialysis, ensuring his remaining time is as comfortable and fulfilling as possible. This example illustrates how respecting autonomy in clinical practice often involves complex and emotionally charged decisions. It's not just about the medical facts, but about deeply engaging with the patient's perspective, understanding their life's context, and supporting them in making choices that reflect their personal values and wishes. As healthcare professionals, our role is to guide, inform, and respect, not to dictate. Now, let's explore a critical scenario often encountered in emergency departments. Picture this: Robert, a 70-year-old patient with advanced heart disease, arrives at the ER in a critical state. He has a legally binding do not resuscitate, or DN order, which he had previously put in place, clearly stating his wish not to receive cardiopulmonary resuscitation in the event of cardiac or respiratory arrest. However, upon his arrival, Robert is unconscious, and his family, unaware of his DN order, insist on full resuscitation efforts. This situation presents a challenging conflict: the patient's expressed wish for no resuscitation versus the family's plea for life-saving measures. In such cases, the principle of patient autonomy is paramount. The healthcare team must honor Robert's DN order, as it reflects his autonomous decision made while he was competent. The role of the healthcare team here is multifaceted. First, they must verify the validity and applicability of the DNR order. Once confirmed, it is their responsibility to follow the order, as it represents Robert's wishes regarding his treatment. This adherence to his autonomy is a fundamental aspect of respecting his rights as a patient. Simultaneously, it is crucial to communicate empathetically with the family. The team should explain the nature and significance of a DNR order and why it must be respected. This conversation should be handled sensitively, recognizing the family's emotional distress, while providing clear and compassionate explanations about Robert's wishes and the ethical obligations of the medical staff. This example demonstrates the complexities that can arise in emergency settings, especially when dealing with end-of-life care. Autonomy remains a guiding principle, even in the face of family opposition. In the emergency department, where decisions are often rapid and high-stakes, understanding and upholding a patient's autonomy, as expressed in advance directives like DNR orders, is both a legal and ethical obligation for healthcare professionals. To sum up, while autonomy is a cornerstone of medical ethics, it's not absolute. As emergency medicine professionals, we must balance this principle with beneficence, non-maleficence, and justice. Our goal is always to provide the best possible care, respecting our patients' rights and dignity. Thank you for joining us today at ER Mentorship Hub. We hope this episode has shed light on the importance of autonomy in medical practice. Don't forget to like, share, and subscribe for more insights into the world of emergency medicine. Stay informed and stay compassionate. Until next time.